News 3's political reporter Jessica Arp joins us now with more on this measure and how it could impact Wisconsin. Jessica?
Well, the two main moves people are watching and in some cases concerned about here are the Medicaid caps and cuts to funding and changes that would give states more decision-making power on pre-existing conditions.
To me, pre-existing condition means cancer.
A rare form of bone cancer struck Kay Locke's son Ian at age 16 7 years ago.
After you hear the words, you have cancer, your minds go to a million different places and nowhere all at once. But one thing we never had to worry about was appropriate health care for Ian, for my son.
Ian survived osteosarcoma and is now in college, but with the House passing a health care bill that could make changes for those with pre-existing conditions, Kay is left wondering what could happen next.
I fear the day that he could be told that either, I'm sorry, I can't provide health insurance for you because you have a pre-existing condition. It's even really very difficult for me to say those words because they have such a heartfelt meaning for me.
The House bill allows states to decide how pre-existing conditions can be covered, possibly moving those people into a high-risk pool. We asked the state's Medicaid director what that possible change could mean in Wisconsin.
The flexibilities that are being discussed are also designed to address pre-existing conditions, but in a different manner. That doesn't mean we would do it or another state would do it. It's a flexibility issue.
Wisconsin and other states will now consider what to do for Kay, whose son will graduate college next week and move to Utah to research osteosarcoma. She is fearful for what any state might do.
It terrifies me to think that he could be put into one of those high-risk pools and the essential services. When you say essential services, my son received those services, and that's what kept him alive.
Republican leaders have said this pre-existing condition measure will require states to submit a plan on how people would be covered under any high-risk pool. But groups like the American Cancer Society say there are too many questions, and the American Medical Association is concerned that states could choose to opt out of essential benefit coverage. All of this, though, is contingent on what the Senate will do next, and many folks believe there will be changes made there.
There's a long way to go. Jessica Arp in the newsroom. Jess, thank you.